Hello everyone, welcome back to my YouTube channel. So in today's tutorial we shall be discussing types of IV fluids and their uses. So in today's video we shall be discussing common IV fluids and their uses. So what are IV fluids? IV fluids are liquids administered directly into a vein through an intravenous tube. They are used to treat dehydration, replenish fluid lost due to an injury or illness. They can also be used to provide nutrients for the body. So we have different types of IV fluids. The commonest are, the first one we have is sodium chloride or normal saline. So normal saline is the chemical name for salt. The generic name is sodium chloride. It is a sterile non-biogenic crystalloid fluid administered via an intravenous solution. Normal saline is used for extracellular fluid replacement, for example, vomiting, dehydration, hypovolemia, hemorrhage, and sepsis. So remember, a normal saline or sodium chloride can be used to treat the following conditions: dehydration, vomiting, hypovolemia, hemorrhage, and sepsis. Normal saline can also be used to flush, to clean an intravenous IV catheter. This helps prevent blockage and removes any medicine left in the catheter area after the patient has received an IV infusion. So dosage is dependent upon the age, weight, and clinical condition of the patient, as well as laboratory determinations. It is avoided and contraindicated in patients with cardiac and renal disease and pulmonary edema. So normal saline is contraindicated in patients with cardiac disease, renal disease, and pulmonary edema. So the second one we have is Ringer's lactate. So Ringer's lactate is also known as Hardman's solution. So it is an isotonic crystalloid containing sodium chloride, sodium lactate, potassium chloride, calcium chloride, and is sterile water for injection. So it is used to treat acute blood loss, electrolyte imbalance, and metabolic acidosis, trauma, burns, and hypovolemia. So Ringer lactate infusion is used to treat the following conditions: acute blood loss, electrolyte imbalance when the patient has been dehydrated, metabolic acidosis, traumatic injury, burns, and hypovolemia. So Ringer lactate is contraindicated in patient who has a pH greater than 7.5 or patient with liver and kidney disease. The third we have is dextrose 5%. Dextrose 5%. So it contains 5 grams of glucose and is sterile water for injection. So it is administered for hyponatremia, and to provide free water for the kidneys. So glucose 5%. It is used to administer hyponatremia for patients who is unable to eat, or maybe someone who is very fatigued or feeling weakness. So it provides nutrients for the body, because glucose provide energy for the body, so that the patient can gain back the energy he lost due to an illness or injury. So it is contraindicated in patients with cardiac, that is heart disease, renal conditions, kidney disease, and diabetic. So you cannot administer dextrose 5% to a patient who has a high blood sugar level. So avoid and never inject to a patient who has a high blood sugar level, that is diabetic patient, kidney disease patient, and heart disease patient, that is cardiac disease. The fourth we have is glucose 10% or dextrose 10%. So we have discussed the dextrose 5%. Now we want to discuss glucose 10%. So it contains sterile water for injection, and glucose. So it is used to administer a patient who is unconsciousness. The patient is unable to drink or eat something. So glucose 10% is given to a patient who is unable to drink or eat something, or who has a hypoglycemia. So a patient's blood sugar level that is very low. So you can administer to a patient whose blood sugar level is very low, that is hypoglycemia, or a patient who is unconsciousness, unable to drink or eat something. So it is administered, or dosage is dependent upon the age, weight and condition of the patient, as well as laboratory determinations. So it is given 5 ml times body weight. So the formula of administering glucose 10% is 5 ml times body weight. So it is given 5 ml times body weight. So that's how we administer for glucose 10%. So I hope you have seen all of them. Thanks for your watching and have a nice day.